Next, we take a look at the differences between rhythm and conduction. Rhythm is the heart's pace or beat, which is a strong, regular, repeated pattern of movement. Conduction, on the other hand, is the progression of the electrical impulse through the heart, which causes the heart to beat. You can have a conduction disorder without having an arrhythmia, but some arrhythmias arise from a conduction disorder. And when we talk about an arrhythmia, also sometimes referred to as a dysrhythmia, this means that there's been a change from the normal sequence of electrical impulses and refers to all rhythms other than normal sinus rhythm. This is when electrical impulses may happen too quickly, too slowly, or erratically, causing the heart to beat too fast, too slowly, or erratically. When the heart doesn't beat properly, it cannot pump blood effectively. And when the heart doesn't pump blood effectively, the lungs, brain, and all other organs can't work properly and may shut down or be damaged. Conduction problems and arrhythmias can be categorized in the order in which the depolarization wave usually spreads. So if you look at the diagram, you've seen this one before in the heart's fail-safe pacing mechanism. So conduction disorders are categorized in terms of sinoatrial disorders, atrial disorders, AV nodal disorders, and ventricular disorders. In the interpretation of ECGs, the word rhythm is used to refer to the part of the heart which is controlling the electrical activation sequence. Now, normally the SA node is responsible for initiating the depolarization sequence, and when that happens, it is called normal sinus rhythm. However, in patients with structural heart disease, as well as those with normal hearts, deviation from the normal depolarization sequence may occur. Anything other than normal sinus rhythm is referred to as an arrhythmia or dysrhythmia. Conduction problems can be categorized in the order in which the depolarization wave usually spreads. The rhythm of the heart can be interpreted from whichever ECG lead shows it most clearly, according to some sources. Usually this is in lead 2, and for purposes of this course we will interpret the rhythm from lead 2. Next we will be looking at how does one determine the regularity of the rhythm on an ECG. So using your booklets, you can use any of the ECGs in there. You take a piece of blank paper or a set of calipers, lie that down across the baseline of the ECG, and we're going to mark the point at which the R waves are at their peak. So you're going to mark down this piece of paper and measure between those peaks. If the difference is more than 3 small squares between any of the R waves, it means that the rhythm is irregular. If it's a small variation of 1 or 2 millimeters, it's fine, the rhythm is regular. Pause your video for a short while and refer to the PDF that you have downloaded, which is called ECGs Can Be Easy, Rhythm Strips and 12 Lead ECGs. You will find 32 rhythm strips and 31 12 lead ECGs. Do at least 10 examples from the practice ECGs provided and make sure that you can easily interpret whether the rhythm is regular or irregular. If you are using a 12 lead ECG example, remember to use lead 2, and if you are using the rhythm strips, you can just assume that they are lead 2. When we want to determine the heart rate, the first step is to determine whether the rhythm is regular or irregular. Thus, the exercise in the previous slides is very important. Please be comfortable with that before proceeding, and it's the same for all the exercises to follow. Make sure that you master them one at a time because often they build on each other. So, looking at determining the heart rate, first we determine, is the rhythm regular or is it irregular? Then, if the rhythm is regular, there are various methods that we can use. The first one being a rapid calculation of the heart rate, and the second one being a much more precise calculation of the heart rate. If the rhythm is irregular, only the rapid calculation method can be used. When looking at heart rate, we are going to use lead 2 again, and we need a rhythm strip that is at least 6 seconds long, or 30 large squares. You will find in your PDF document that you have downloaded, all the rhythm strips are long enough to determine the heart rate and rhythm. So when the rhythm is regular, we can use a rapid calculation method to determine the heart rate. Remember this sequence: 300, 150, 100, 75, 60 and 50. It will help you in the next slide. There are two methods to determine the heart rate if the heart rate is regular, and that is a rapid calculation or a precise calculation. Measurement of the heart rate refers to the rate at which the ventricles depolarize. So it's ventricular rate that we are actually measuring, unless the atrial and the ventricular rates differ, in which case both will be given. But for purposes of this course and purposes of learning a normal ECG, we are looking at only the ventricular rate. The normal heart rate is 60 to 100 beats per minute. So for purposes of this, you're going to refer to your practice examples in your PDF document provided. You can look at the rhythm strips, and when determining the ventricular rate, you need to look at a 6-second rhythm strip. So at least 30 large squares need to be on the rhythm strip in order to determine the heart rate. So if you have a look at your rhythm strips, you will see there are 32 examples from which you can work. You'll see at the top of each rhythm strip, they've nicely indicated 3 little markers, and that the first one is the 0 point. The second one is after 15 large squares, which represents 3 seconds. And the last of the 3 represents 30 large squares or 6 seconds. So you can go ahead and use those to practice. If you look further on in your booklet, you will find some rhythm strips and some 12 lead ECGs, and you'll actually need to determine for yourself the 6 seconds or 30 large squares. So if the heart rate is regular, there are 2 methods to determine the heart rate. One is by a rapid calculation and then by a more precise calculation. So firstly, we're going to look at the rapid calculation. Before we start, just to recap, 30 large squares is equal to 6 seconds. So multiply that by 10. That gives you 300 large squares. That represents 1 minute or 60 seconds. So using the rapid calculation, you're going to take the 300 and you're going to Determine the number of large boxes between QRS complexes. So as we did before, you're going to lay a piece of paper across your rhythm strip, mark the top of the QRS complex at the R wave, mark that across the 6-second rhythm strip. Then you're going to count the number of large boxes between consecutive R waves. Write down that number and then go to 300 divided by the number of large squares between the two QRS complexes, and that is going to give you your heart rate per minute. Another quick way to determine the heart rate is to look at your 6-second rhythm strip, to go along and to count the number of R waves in the 6-second rhythm strip and multiply that by 10. That equals your heart rate per minute as a very rapid calculation and a rough guide as to whether the heart rate is in the normal range or not in the normal range. Remember, this is only applicable if the heart rate is regular. If you want to be more precise, then we are going to look at the small squares in between the QRS complexes. So remember, there are 5 small squares in each large square. So if there are 300 large squares per 6 seconds, then we multiply that by 5 and we're going to get 1500 small squares in the same period of time, 1500 small squares in 6 seconds. So if you want the precise method, you're going to take 1500 and you're going to divide that by the number of small squares between 2 consecutive R waves, and that will give you a much more precise heart rate per minute. If, on the other hand, you have a conversion table, I have provided you with a conversion table for this course. You are going to simply count the number of small squares between 2 consecutive R waves and then refer to the conversion table. And this method is very accurate, but can again only be used when the rhythm is regular. So here is a visual example of how to determine the heart rate if the heart rate is regular. So 300 divided by the number of large boxes between 2 consecutive complexes, 2 consecutive R waves. So look at the pink block and you will see just below the pink block there it's indicated. I've counted the number of large blocks between those 2 R waves indicated by the red arrows. So there are 5 large squares. So we are going to take 300 divided by 5, which gives us a heart rate of 60 beats per minute. Alternatively, we can count the number of R waves in a 6-second rhythm strip and multiply that by 10. If we want a more accurate measure, we can count the number of tiny small boxes between the R intervals, R to R waves, count the small squares, 1500 divided by the number of small squares. Alternatively, you can count the number of small squares and refer straight to the conversion table, which is in the next slide. Pause your video for a few minutes, go back to your ECG examples and practice interpreting the rates when the rhythm is regular. So at least 10 examples where the rhythm is regular. When the heart rate is irregular, and for this you can look at your rhythm strips, examples number 4, 5, 6, 8, 9 and 10, just to name a few. The heart rate is irregular, and in this case one can only use the rapid calculation, which will only give us a rough estimate of the heart rate. So just a reminder, the rapid calculation method is the number of R waves or cardiac cycles over a 6-second period multiplied by 10. So if we have a look at this example, we do see that the rhythm is regular, but we're using it as an example because it's very clearly displayed. So if you look at the first QRS complex, that is the 0 point. And if you count along, you'll see that there are 10 R waves or cardiac cycles within a 6-second period. So 10 cycles multiplied by 10 gives you a heart rate of 100. Alternatively, you can look at the number of R waves in a 3-second strip that has been marked out in red in this example and multiply that by 20. So if you have a look, the 0 point is the first QRS complex, and then you will see there are 5 R waves within a 3-second period. Multiply that by 20 and the heart rate is 100 beats per minute. Pause this video for a few minutes while you go back to your practice examples and go and interpret at least 10 examples where the rhythm is irregular.